Hi, my name is John Burroughs. I'm President and CEO of the Burroughs Healthcare Consulting Network. With all the political noise around the Patient Protection Affordable Care Act, or Obamacare as it's more commonly referred to, it really didn't fix the healthcare system. Yes, we'll have another 32 million covered lives. Yes, the insurance companies won't be able to deny you based on a pre-existing medical condition. But the problem is, if we're really going to get serious about fixing healthcare, there's some things that we really have to do. So you do want to introduce new technology and new privileges, but you want to do it the right way. Remember, the Joint Commission says that privileging should be an objective, evidence-based experience, which means you want to create objective criteria. So the 4 steps I would recommend are: number 1, discuss and negotiate standardized approach to developing new technology and new privileges. That means a policy and procedure that works for the medical staff, works for the governing board, and works for the senior management team. Number 2, considering developing a joint physician management healthcare technology assessment program. Now, larger organizations will have a group consisting of physicians and managers who look at new technology in a systematic way. If you're a smaller organization, you can do this far more informally, but there should be a group of individuals who vet new procedures and new privileges. Develop the policy and procedure I talked to you about, and implement it and refine it. So let's talk about the U.S. healthcare system. Why do we have to fix it in the first place? We spend more per capita than any other country in the world. In fact, almost double any other country in the world. And yet, what do we get for that, all that money we spend? We're ranked 39th for infant mortality, 43rd for adult female mortality, 42nd for adult male mortality, and 36th for life expectancy. So why do we spend so much and get so little? That's what we have to fix. I've heard a lot of hospitals talking about how do we work better with our physicians? How do we align the interests of physicians and hospitals? It's tough to do when you don't have relationships with your individual physicians. And remember, you can't have a relationship with the medical staff. You have to have relationships with each individual physician, because each physician considers themselves an individual with individual needs, wants, and desires. So the first step is identify physicians who are important to the organization, both quantitatively and qualitatively. You can look at the amount of money they generate for the hospital or bring into the hospital per year, but you should also look at qualitative factors. Do they bring leadership to the table? Do they bring personal qualities to the table? Are they an opinion driver on your medical staff? These are the people you really want to work closely with.